SEO. Ni kind obesity, you can be a cassia and a cassia. In fact, a very complex health issue. Entire complex health issue, you say, okay, first of all, anyhow to treat it. The management, a hard one. It's very complex. Say, and easy. So, bit me treating this out. There were so many ways at deba, and there were so many multifaceted conditions. And I say, yaya who will be bra a deba. Anyway, maybe ubi nejina hamano. But there was a real case situation. Oh, my hospital, maybe I got any. Mfanchemik, miti ya miaka kredi, mfanchemik 17 kasade. Oye gane ni, ena, oba a hospital. In fact, or a nurse. Na, obedu ya na midinidin K, because I don't want to mention her real name. Mekani di empire. Na, oba a hospital no. Na, when you stroke. And I say when you stroke. Oh, nejumem. Only oye nurse ni, oye nejumem. Ena, omadine ba ya hodom. Obedu, you know, yes, me share. Na me share ni history. Oni Arabia, oni condition bia, oni hypertension, oni diabetes, oni hwe. Nti fairly no or a healthy person. When you stroke. Nti me review medication and I send a note doctor for natural no. And I'm short to say. Na say I was started weight loss medication bi. Enura hodwa. Na say yeah enyo no ma make say wo. Say na be so betem. Na say I was started bi. E ho na mo di nose ni epem. Nti na me dwen say nti is it possible say bia a drawing na mama mi enya stroke ya na? Okay. We are just an open statement, an open case, and that's why by the end of this presentation, we can draw our own conclusion. So, Madam key history into. Because of the I had me to make up from your BMI body mass index, and it determines will be a or you're overweight, and also you're obese. Normal weight is between normal BMI weight is 18.5 to 24.9. We are underweight, I guess we are below 18.5. Overweight 25 to 29.9. You're about 30 year obese. In fact, your different classes of obesity. We can even have extremely obese people, are more BMI greater than 40. The other degrees, first class, second class, and on the moment infant or a bit more extreme one on from morbid obesity. To say morbid kuno, Kasiana, I can say Brosama a kuno. Causes of obesity, then the ma sa Kasie Musway eba. In Rua would be a yanum, a bit near causes sweetened drinks, soda hot wine, and ye young can say or gut hormones, in no be where young one to me causes smoking, genetics is a wusum, a who are to make us a busia with the only I can say for. Saying to me, year lack of sleep, inactivity, so what if I come, better if I come with tea, sorry, I'm not confident you're not be new attendance out if I go near and overeating a didium so. So animal eating my can bros na genetic factors no. Sinam di kan ni me boss ni na betima chem mienu ni abetima control na do I uncontrollable. Ni won't even control no mostly air genetics. Certain genes away ni peduamu a etimi my can bros so no yen den a untimi sesa no. What you can do is use your lifestyle change factors no. Now they are controlling kakra. Lifestyle no ebi ni say aduani a wudie say we exercise ahodwo and na obe change your sleep pattern and ultimi boa say na making na once some lifestyle patterns one year here and so bit more like say abroso afi your environmental factors no ni na social say smoking cigarette nom aduani ahodwo bi a yedie and also bit me akoso sa na emu bi a yedom say na di kan kai no mostly steroids it may be a ebroso and I say will be a hypothyroidism. It be also a psychological behavior. Yes, I didn't want you. If we want more to 10 beer and so need. Those are emotional eaters. 10 beer adwene no ka kyerɛ sɛ didi kyerɛ sɛ there's no way na adwene nka kyerɛ sɛ wame nti odidi saa ɔno ndidi a so I am bored nti ne wetimi di agye n'ani ana sɛ nka obi pɛ sɛ ɔyɛ exercise bi ɔyɛ biribi ɔno deɛ ne deɛ nso bɛdidi and ebi no cause so anxiety, depression. These conditions can all lead to overeating. I feel ntimi end the year and also disrupting your hormones. Emma a bit me also obesity. I feel social and cultural influences. Ebi one more your busu and I say culture a film no. Enuani ahodo a omo die ni nyina ya nwa nkwa tebia they are eating meat. That is their lifestyle. And also bit me cause sa. All right. It is obesity. Ni sunsun so bi kra na say. E di enti kra na so abeye big talker. E enti inu no be start use your cardiovascular disease akoma any your veins no mu yare a bit me say veins bit me si pe na fe we nya heart attacks no any stroke. A bit more high blood pressure, diabetes. And so obesity bit me cause ça because we did not be brave na kwa starch e be dania ba sugar na fe sugar na e cause afei e bit me cause cancer. Some of these hormones and fats no e be release ni pediem a it me cause a lot of cancers ni pediem bit colon cancer, breast cancer na prostate cancer, osteoarthritis, excess weight nse why omom ye kese no we kese sedan a online onantu no ntimi nye kese senia osoro no ye kese no nti you are putting so much weight on your joint, on your knee go to dwenu no all the so much weight eguso sans anti weight mean osteoarthritis after mental health issues. People get low depression. I mean they get depression, anxiety and a low self-esteem also osonti opie kura mpo anofere. So me send me swing na for best rem and sama for best rem. E won kwala mu e won panifo nyina nso mu. They all go through the same thing. All right. Into genetic factors no. And I'm say ebi mu ye genetic nya wo dipedem ntimi nya hwe. Some genes regulate our appetite. Into say all genes no wo dey ntimi regulate your appetite. Appetite say be catch us one man. If you don't have those genes, and I say your genes are malfunctioning in controlling your appetite, it means you can be overweight. Afei, metabolic rate. Genetic factors play a role in how efficiently your body burns calories. Nipediano, udi asichira, and that's what it burns the food. Mediano, ebedani energy. If you don't have good genes, a bit nipediana convert sugars no into energy, sir. And energy. Let's say you still have the sugar and you have a fat distribution. Nipediana, extra baby, and these genes direct baby fats, or baby fats, and cogo. To be one my fats and the food, the yam negu, a bit diego, a bit diego, betty, and it's determined by your genes, actually. After treatment. This obesity, or the class of obesity is here one. You can see a treat here. We call Dr. Hanuma. Mostly, the answer the first way I'm first treaty is about your dietary modification. So when you know the better say we did be bread so I will say we eat more vegetables, fruits, whole grains. Only near sugar no dust be bread. Ni na be catch strong. It also mean or the catch be exercise. About 150 minutes per week, moderate to intense exercise per week. Behavioral therapy. More dear, more started SCK behavioral therapy. A fee and when Timia, neither I started a treaty. Until Diano is about medication, so I'll come back to that. So no, man, and qua. Nothing on the surgery, Abem. Surgery, Nibini, gastric bypass. O Yamono. Omutimi trabi stomach no ne odi die kogum no omutimi trabi free ho ana so omutimi mane yaketwa nti odi die aduan kakra bi gumu ape then you feel full na ma woni dibio and they no so abe one of the practice across hospitals in fact my hospital one of the money making surgeries are omo ye ho. All right, let's get into enrono ehwasem. The common medication that omodi treat weight loss a class B from GLP-1s. GLP no glucagon like peptides. Glucagon oyam eno na udidi a and I said that hormone no udidi a na afei you feel full afei aduane no nso a decreased amount of the rate aduane no basically they control your insulin udidi a na catch o pancreas say insecrete insulin na afei entimi burn sugar no afei what again we meet me aye bio so no say eboa ema so we sugar glucagon bet me a converted glucagon ema glucagon no change be asichire na oni padua na so we di ya glucagon is one of the ways that body no store carbohydrates. All right. Inti so here me graph here homa yes for me about say graph right from 2018 eba no na say no way nyina emo wo ho most of them na around. In fact, almost started approve the first one around 2005. And Nijumedi na AD part say it is for diabetes, to control diabetes. Now the intention was not to control weight. But omo use na no say omo use say no to treat their diabetes no almost so te. Into almost so te there it means they can get a second advantage of the medication. And the other be in there. And from the graph no already from 2022 urban I said 2021 urban and then they start realizing say okay rating using for the front the rate of usage started cost rate of prescription from 2000 started cost now here from 2024 actually it has semaglutide when intia watching it is because ni back you know the year and Ozempic no Ozempic until Ozempic no a use for diabetes na no say mani pan sort na fe company no start convert another dose high dose I be treat weight mo to need Wegovy from 2003 2004 up to now you say the rate of prescription the cost per year another class and say and also a cost tezipatide and also and only Zebound na no so on diabetes draw on afi hu say no so ebo na the converting to weight loss and Zebound and I also appedia cost dulaglutide and also money started cost so basically from 2023 2024 we say no we more cost but near cost a rise per Zebound and a Wegovy semaglutide ne tezepatide. And so I prescribe a do man. It is important as a doctor no. We a doctor for advice, but obesha current condition. And know how do I know family history, medication cost, and I know the side effects. Now for your marshal BMI, I'm can 17 say if you qualify. And mostly is for MP4, but some class like semaglutide, liraglutide, all this that. Homo in age 12 and above, so tell me the mouth. All right. In general, weight loss medications are hard at one market. And I say, what you just what you used to. Your liraglutide and phentermine. Liraglutide no friends Saxenda. Semaglutide and no. And so it's me to control weight. It's also for diabetes now. Basically for Saxenda is for weight control. Any of phentermine and also the control weight. And your other combinations, the different time after to pyramid and quismia, and also your country, na contra V, na trexone ibuprofen, and your sets melonite, and also another one, Olistat, and so ora, and so Ebomas, and only Jumedi answer block enzymes. Ebe breaki eduana be the man I am block the omo. Into the dia and yam. I say that's what yam say mostly. We just no. Say I want everyone to be done. But say I want that so far. Said we just no. The people doesn't really like it because of that effect. No. Your hydrogen and so on. If they say but yeah, if they see you know something me jump. No, I would be at now say I must start to develop because of who say first ones no more engagement, you know. Lily Lily for started another medication. You another one say friend retired and also ba Pfizer for also another GLP and Amgen for also AABA and so nam so eba. All right. So compare all these weight loss medications I come once a year. In fact, juma. It works. Differ liraglutide, for example, 5 to 10% weight loss. So average weight loss within a month. Phentermine, and so you get the same thing. Naltrexone, and we are also juma sa. If you remember the injection, so this class, the GLP ones, not all the other ones, only the GLP ones, because Omuna, Inia, Wegovy, and Zebound, no, Afrim. It was for diabetes. Now, if you say a control weight, no, and I must start a use, and I must start a treating. Some of the new ones, Wegovy, started by around 2021, and Zebound, and so about 2 years ago, and only Tezipatide, because and only Wegovy, that's the most popular ones, only you know, and as I say, that's what one for use Zebound, the weight requirements, and some between the mobile 30 and above. In edema. Contraindications say who or not person who uses Zebound that. Or say you have to make sure you're not pregnant because they're not for pregnant people. Or other existing conditions. Also, no doctor, I can't really be our awesome and sana wako. And so no fufu be answer. I was say only doctor can awesome and sana. Pastor tell you suicide in Norway. The other one is the semaglutide, which is Wegovy. Wegovy so approved 2021. No, the my children and I did a few doom you know. It's me you see in Rono. All these ones are injections, actually. Nafi, Tezipatide. And also EDME. There's another one, Munjaro. I know the kind of two combinations. That is GLP-1 and GIPs. People use it, but not that's so much as Zebound and Wegovy, and also on. Now, how do they work? So no way they are all injections. How do they work? They work by one, mimicking the action of human incretin GLPs. The GLP na control amount of insulin abe use. Say the time where they feel stomach emptying time. It slows the empty of the stomach. Inti 10 bia na so hono one sense one mean you don't even feel. Inti omo wo sampani omo go back say di say wait not the whole day. No ndi because no dey no di no. Era so won yemo enyam ye. Inti 10 bia they feel full. I feel increased insulin secretion. It can have appetite reduction and so can say ma common do. Ni you di pa edino. Potential benefits of for obese individuals. Emphasize saying no win potential benefits and just full benefits. A bit me emphasize a bit me and say one clinical trial shows say at least 15%. Average weight loss of about 15%, which can be life changing for obese individuals. I can say I try knowing the but to try do within first month to 3 months. Now we are when you have 15% weight loss. It's good. And I say, we have no need so dear and kayepa. I feel it also improved glycemic control. More diabetes, no? Say, or obese, no sound diabetes. That is say, wait, but ready. You know, aman. afei potential health improvement. Weight loss can lead to reduced risk of obesity related. Also, make us say yare ahodoɔ a kɛseɛ de ba no. Nti sɛ woso te deɛ no saa yare no nyinaa no wobɔ wo ho ban sɛ wote wo ho afiri ho. And so you are getting out of it, which is a good thing. Afei yɛnkɔ nea yɛhunu so the known side effects. Yɛ start akɔ ne side effect no so. Nti ne di kan very common nausea. Afei wobɛtumi nya vomiting, diarrhea, abdominal pain. These are very common. Ɔmo used to say no almost obiara complaining about nausea, vomiting, diarrhea, and abdominal pain. And if you talk about, there's another one, gastroparesis. And in nausea, at least every year, there are about 20. It's a reported a case of about 25,000 people in the ER and going through this. All right. Now, maybe was a common one. There are also some long-term effects. And I say, these are some of them are long-term. Some of them we know. Some of them we don't know. Because they're grown by in the trials. No, I want to mean any there are some long-term effects that we don't know. Another one is thyroid gland concern. Say thyroid gland in the minimum control the amount of the thyroid. Thyroid in the control metabolism. So be the you know be juma near that in and the control sir. I don't know. It's say when you say if you only are doing only develop you na be goita na po issue minimum. Yeah, sorry. All right. You see, it means there also possible development of pancreatitis or pancreas, and they develop amount insulin man. Now, it's say stimulating the brain. There's a chance of getting pancreatitis. Artificial satiation. And there's so much long-term effects in him. Another one, bowel obstruction, gastroparesis, and biliary diseases. This bowel obstruction, I say more block it's more blockade into. I say, would be also block into night. It's very painful a situation. There was so many other side effects. Bowel obstruction in treating here. Gastroparesis. Also, papa surgery, and I'm on eye surgery, and Dr. Becker said, the next 24 hours, many until Cassan said, we did, Riano, it's me, Bobasro. Now, a bit choky, because one is anesthesia, and anesthesia, no, don't beat me, a bit choky, Bobasro, a bit me, a bit choky. But if you no more, now a cough or how we pray ever. All right, until catch yourself, the biliary disease. Or gallbladder na and so me a blockade. Now fe oyenya jaundice. All right. Me de sa ade we eto so na sa ade all this line ne kan fa ho na weight loss and associated with semaglutide treatment for patients with overweight. Only research about semaglutide. Here we go, Now, these are the people who involved black and white, Asian, all different races, any age. Now, research about, in terms of percentage, about 85%, any adverse effect. She said, all adverse effects no me. Nausea and vomiting, 64%, diarrhea, 15%, fatigue, 11%, constipation, oh, these are the numbers, and these are the percentage, 48.6 adverse effect. Constipation, about 5.7%, abdominal pain, headaches, acid reflux, and others. Inti, nimdi kan boss so all the side effects nimdi kan boss no. Ampa, honum, possible say one who a bit me. Anna, weight gain and dependency. You had you say no way, say. A drone ujay no more, and as a ujay why, no, sorry, at the wall. Ujay Yusua, what's I can save you. And ya dear, say 1 month, 1 month, no, 1 day, and first what you be 1 year. Na, we jat on, no, because we interfere him so better, and I send him a swat in moment, no. We send ya, weight gain, we send ya, being yet. Idea 1 time a year, and I say 1 year, you have to be on it for the whole life, for your lifestyle, and your lifespan, sorry. Sana be said it to him. The initial weight loss on there significant, but as soon as we get and the other side of the campus is very rapid. Weight gain, regain, rapid, about 10. And one research said many patients regain large proportion of lost weight soon after stopping the medication. Soon, we get a large proportion of started a review. Again, there's recurring issues. With that lifestyle change, the patient may mistakenly believe obesity is cured rather than remission. All right. There's another researcher, a friend Atlas mapping, and say Atlas research. Now, I know the only involved in involved with different countries. And also, let's taste so many possible side effects. And side effects are na almost here be nausea and vomiting. On say, oh, that's what I say. We have a paper, but I'm going to pointer now. But don't we pointer now? Come screen so. Okay, so who about nausea and vomiting. And now more dot near orange, you know. And now that's what it is. The further you go on your right, no, it's just the higher the number. If you start to remember the just the further the higher the chances of side effects. No, into it say nausea and vomiting, nephrolithiasis. A drone, say, and I say one of the benefits they say it protects your kidney. In fact, over this side, I should see somewhere and point it to you. So kidney protection. I'll show you somewhere. But over blue, no. The blue is the advantage part of it. But over here, the orange one is the disadvantages. And you're fading, no. I just say a possible 70 years. Although I'm say protect your kidneys, but as I'm on your nephrolithiasis is kidney kidney nephrons no inside no unya inflammations so I feel GERD and only yam and inside acid reflux no but also very high. I feel sleep disturbance be nipa be complaints on ma na ntimi na yi abdominal pain, prostate cancer, arthritis, arthralgia, tendinitis, tendons no one 9 special 9 uso mana say emuago usi for mana as muscle no ATF in it's very painful. I feel headaches, gastritis, ebikranya hemorrhoids. Unse hemorrhoids if you gana catch say koko udi starch will be no koko and it has nothing to do with starch. But veins no in a emre nti ne to asena emre no na pointy out sir. If you are osteoarthritis medical can wasem hypotension, interstitial nephritis, syncope no how as no be no about form and gastroparesis say omo odidi anaduan no esan eba nestro. Afi mehe nyamembo di wa say okay, I think say everything here can wasem. All these are possible side effects. Na nyamembo so na na bi en hono an so no normal, mild. Into case that is normal. That is normal. It doesn't really matter. Idea also you can have some ulcerative colitis, erectile dysfunction, melanoma. Melanoma is a kind of cancer. So, nafi, more asthma, people asthmas were triggered. Benign neoplasm, and you see a cancer, bladder cancer, abdominal hernia, kidney cancer. Anti the side effects no. You can talk of that, and they are all possible. All right. Anti and our map we are draw to answer. It also talks about the same the same side effect. Bone pain, pain power, so all right, with this in mind, no, now the whole say, no, both we go Venezuela band, no, the hyper, no, and the social media, we account some celebrities, I just my endorse on. Oh, and you know, I say, indeed, Obi or Tabon, be answer person or Kobe, no, so the sotier. I feel market potential, I say, no. It is bringing so much billions of dollars into this manufacturers. Uber it's estimated that by 2021 it will bring about 150 billion. Big cancer medications are profitable making. And obesity is a pandemic is a idea. Niparudo pan will be yes, you know. And yet, like I said, these manufacturing companies are not ready. There's also another concern. A person can have some celebrity endorsements. And all the side effects, no, people don't talk about it. The benefits in there are lifestyle drug prescriptions. And idea one time lifestyle. Lifestyle na bona. Can you afford it to be on it? Because and there's also concern of black market risk. Black market is say offer her behavior. Nothing. You can say even on Facebook and all the social media. What you can get is very easily. People are making mini doses. Mini doses of whatever no much syringes na more ton in bits. Small syringes, no more ton. Now besides say in your hospital until you say a good syringe no. I will say IV room. IV room, no, that place has to be very clean. And from my AP, everything has to be regulated. Oh, Korea, you have to dress well, wash your gowns. If you have to wear about 2 gowns. We share boots. 2. We share a chair hair cover. Oh, about your side, you have to cover everything. Until you say, baby, I'm air draw up these medications. No, are they sterile? So yes, sterile one. Apart from so many adrenaline side effects, no, you can also get infection. And say, Obisa will be a clinic, will be opportunity between us, Facebook, this or Tom baby, or that, the brewer. It was arranged. It is easy, and also, another one, or Gia another every man, dear, now order a beer brand, you know, only maybe a drone fever. You need to say on the order, you have to be careful. There's also potential overdose because it has to be dosed based on your weight. And I say your BMI. And so we need all those advice, no, nationally, now they want then you are also at risk of overdosing. All right. There are also other access and safety concerns. So we can access no. I don't know about it. And say some insurances we do. I don't know how many insurance are covered there, but say if insurance be also on cover also it's around 12,000 to 16,000 per year. If you're using the brand medications, no. Other than that, no. Say you're able to talk and I say we are looking at insurance. I'll be covered there. Now you say be a swatema. It is also you use no beer. Think about the price. I feel baby supply shortages because of increased demand. Nipa na omo open omo doso. And an unsafe alternative. FDA warns against compounded versions sold online. And I can wasem. Of legal and liability implications. There may be side effects. I've been no say. Nipa be file for class action against the medication. And it's all because you know the side effect. And to say you perceive use balancing the benefit with risk. Although I don't know, about 15% weight loss within the first month, which is good. But think of the cost. So the cost, and if you are using it for 2 years, 3 years, 4 years, can you afford it? If yes, think of the side effects to nothing. A senior or obit me ayafa. The semaglutide, senior medical Wegovy, and it's all part of this. Mention basic nothing, bisa questions. And the side effects news we can say no. They are all the same. Gastroparesis. And the other point I'm basically making another concern and saying so anesthesia. So who use a drug baby in case we will start to use that. Now we surgery. If I no doctor can come and say so one country now. Because so the next 24 hours the next 24 hours minidi. But at the end of the 2 days no. If you want that's what I am. Into also need but maybe I know I am. To one here. The surgery won't say the other Boba straight me block or lungs. Now if you want here na a whole complication na quite deadly. Inti say o surgery. Who use no surgery? It's advised say within 7 days. Ubejai I don't use 7 days and sana. Ebia ubetu aswa what. But the most important thing say catch a doctor now obey your surgeon say who use surgery. Now if you tell me who use to be answer or say monitor now of any of these side effects. As soon as we have a UBR no mankasa. There are other mental health considerations and so on. People they don't talk about it, but their case reports prompted review of about 150 instances of possible self-injury and suicidal thoughts. In probably more about complaining about this suicidal ideation. Say or I saw harm on how more draw so. Labels. Some of the labels, no need to be one the labels. Labels include warnings to monitor for depression or suicidal thoughts. Maybe one more, one fan to social. Indeed, and no one watch on the kitting goes here. And you don't say the entire kind, man. But a very important say, behavior. Nameka, medullary thyroid cancer, ocular effects. There are also other researcher point out say, a be more in your knee effects, your eye. And other unknown long term. So the market benefits no. The potential for market, eso and they are hoping say even in 2024 they clocked about 32.5 billion. These are in billions. Look at how the numbers are going up. A big term in Rubia, all the even cancer medication now. The potential answer about 500 billion market for GLP could represent half of the entire prescription drug market as it stands today. And when to talk to your doctor, what started bro baby? Now starting your vomiting, diarrhea, severe pain or tendons, over 9 cocoa 19 I feel me pass gas, me inflama, and that's me injure 9. Now where starting your jaundice? I yellow. And doctor Ankasa. Now, Abonaman, he said, it's very important so because those are very severe side effects. But they're very severe. There's something is going on in your body. I feel strategies for effective weight. And only you can't say, or say, Udino, where so better sui, obey exercise, behavioral therapy, and sana, a bass will be so a draw, or a draw. One kasa seti go ma I feel support yourself, if you monitor home, stress management. Until with a minimum side effects, and also possible side effects in nano. And I bet you say, Mamia, na make us say, unya stroke, only potential be only Arabia side a history be a unya stroke no. A drone it mania, a drone use no, and a mania stroke ana. And dear, a bit me no way through mafa. You see, with the announced in the American answer, Cassia, a complex a health issue. And yeah, they back up any treaty. It depended at the Kodia Kosoka, so who and more and up to me boa. In South Asia, you can use lifestyle changes, seeking support. And Sapa na Ibia use a draw, no use to do. Sebasa we use a draw Ibia. And no Dr. Nkasa. Now we discuss it with history, health history ye. And Sana, Obestate use a draw ya. No use. Na, near a man, young Misha Semekasa. No, it is for diabetic patients. In this, only diabetes. That's a starting number druya. Who said the diabetes, the side effect, who is known as insulin side effect, hypoglycemia, and many other no. Go to me, Anyabi. In the Manubesia, now, Major Mamma said, more, and I said, Sir, Yemfa, a metatum damas.
Doctor, that's unfortunately the first question. Doctor, that's how yeah, we do on my same the say, limited, we say you go so it. Lifestyle, also, yeah, and more, and no. This is a dinner, medicine, yeah, every boy, lifetime, yeah, and what, and good, you see, you try to say, everybody hospital, and then it should be by itself. We really be a mere attack, and this is side effects to be doing, so you and
that's it. No, Simbisa. I just say that in us, no, go more, yeah, lifestyle in that in I am what in the end day. Same Dika kind weight, obesity, a very complex situation. If you want more, na be a name bakubi, or a day bakubi the woman I would inti, I was a unya specialist, Sana Mecano. And yeah, doctor keke normal family doctor no. And maybe me, I mean, you started the but you do a be a severe situation as a idea. Now also be here specialist make us any be a chakwan. Now most of them so be one man was starting in these companies here you to call up or start I recommend these injections normal. But that shouldn't be the first line of treatment. Or say, although started with senior kind of dietary modification, exercise. In fact, you saw a dietary modification, no. So when you are going to get results over there. You review any exercise. That's the most important thing. And I say if there's any other idea, also you hear about behavioral therapy. That's something they not count. You know any dear. Make us and only a last resort, especially as only diabetes. Our advice is stay away. Me to concern us, but that's the best answer meeting them. That's it.
You doctor, as a or a teaching exam. Next starting Emma Foundation, me impression be the various organs, one function now might come into play as far as the obesity or but along the line and in how you describe it I don't know if manufacturers take into consideration the respective organs and home functions, and because if your side effects na dinner or banana or too much for the sort of risk it may take into these situations. Some time ago, when it comes to a dietary management now, can be there one a factor or influence this obesity. Yeah, especially when you come to the US, how on Kofu one original traditional diets or ethnic diets now will go into other areas, like a lot of Ghana for Hodechi was the Chinese ban Ababeshim, whereas Abia traditionally and as they were growing up, their body had been tuned to Abia. Ghana is now they get over there in a woodsy a hamburger warrior and see all these things come into play as far as the obesity now. But yes, how I think the greatest danger in there, how are these injury or a very serious injury based on but based on celebrity advertisement in it has become so casually used. Now a lot of people that one who pressure doctors and to prescribe it for them now.
Yeah, that's true.
And so I think, and so the greatest cautionary is maybe we will have to consider our traditional foods more than get into all those things. The influences are these traditional celebrities will get us into it. Bibido Ozempic Day, yes, how through Oprah Winfrey, obey so popular. And all those things now, very dangerous. Doctor, I don't know your comment on this. Put across it.
Personally, on the oil, that we were about 3 comments. In fact, these celebrities, no, they are getting paid for promoting those medications. But promoting anyone or then you might think it's the best. Remember, said they are getting paid. They are not going to get a side effect because and one and two, based on a culture, saying your body has been tuned to using local foods. Many China maybe and ecosu. Now, ima break bia no akoto this Chinese noodles ni omunya no na this dark sauce no and guso. Ni also dey there but remember I also thought no, me Chinese ni. When hear them put this area anyway, we probably need kidney diseases here. But their body has been tuned. No more diane. No need pedianon any alpha. Into be said then on your CM also. We said then those the area no yebi. In sending air cannon. Yen be a fever. Ye boy and strong. Yen hama ya natural ones being said. But unfortunately, do baby I had you announced a different thing. Now he now would do my chibi bria. We more Cassiano, and you found a drew be a bezo. Say, no way I can answer me. We soon said then a drone, and I said a boy and a Emma commando. That's a year drone of your Nicoma, Emma and if you want to my commodian. People will still grow bees because they will still eat their bad food. And I said, Niania, Sardinia, and I can see. But the son said, don't mind Omuni didn't know. You don't really feel it, sir. And I will say, it's hard to say, we're here, DDA, not. But say, Ubi one can say now Babro so dear. Send a beacon can now say, ye specialist and Casano with me about people. There are some doctors that they go all the way back to do gene testing to see if it is indeed your gene and a cause. Now, a mobile with me at the about. Let us seek support. Now, I'm hearing a coupon so very boy. That's it for your contribution.
Yo, Dr. Michael Body, Lily Kanye, Yankopon show ni die.
Actually ni BOADU.
Oh, BOADU. Mr. Fachame.
That's it.
Say enru we no. Send watch church and fun or side effects. Eti coming kwa.
Me fa binto so kwa drobia.
Drobia ti coming kwa dia. Nanka nukra na nanka yejadum. Na so yentimi. Isanse we yare kakra na uko. They say Ghana say hospital the commonest paracetamol. BP yebe trama wa uti fi kra na e fro say we dru tama so beji kono because of scanner omunya nti. Na mini aba no di kan bisa question no. Okase chire ya if exercise need those things enya duma. Na me person ka wo summarize in brief be normal me bia e de be boy na just eja inu ekura no o ma bi wa strategy for effective weight management ni waste weight nkwa na nipa e den ya ye be yare di ka bibi kakra che na ja e na wase impon me da se
Okay, and that you know about weight nti na meka say na odi kan in your comment no me just mean can just say oh man no madro that be and then because I see me court because enu so boy see it me no you know ne kwan so a boy because you need to be able to get rid of most of the toxins and no releasing my intimate me can say man no madro so wo BPCC na and then chana one no madro I have fitness we could be a stroke and no more side effect near worse saying oh no madro no nti me ebe hase bitina boy ho ban ebe hwe ho so yie na yenya yare no in fact yeti boni wi asu nsu kwa de yare no fa ho bu no fa ho se nya wo hwe ho so yie wo ho ma naba obi won mo vegetarian we nam imi se nam ne niman basa nsa ne makansa wo hwe ho si won smoky o vegetarian wonye se atobi ho no nya cancer nti bebia ewi ase ya bedu ide yare no ye den ya beba but ye famu die kakra ebetumi aye abo ye ho ban no ye cheche de bia mi se queen so mo bia mo ye nkosere bia na say every Sunday bia mo ye ne bia ye susu kakra ka die adwuma ebetumi abo ye ama zusa so ana se yare a bia to ba susu sia na bia ba kwatri ansa na ebia aba nti sa na metumi ka na eno ni num de ye ntimi nyaa no complete obra yare no ewo aba ni be nse bitima boy ho ban se yenya yare no na se baso banu madun so dia no anum senia doctor no a chew se no na senia jew dia to ho no di so se on te ase a ba chokwa juwadu na bisa ansana wa start here use edu bia one side effect edu bia anti se ele duma na senia o ka se no on kai a na nya fere bisa doctor se na se pharmacist na kwa jedu no say America had here all shop pharmaceutical shop yeah pharmacist on. Just ask her you want to speak to the pharmacist. If you don't know she inside now or prepare no one say one misa technician be you do na ma na be a church go. But all request be so only pharmacist kasa be she be a we piaba na onu be kasa. Nti ye ni mo kasa na mo so ntimi MY. That's it.
So that's it.
Amen.
Or any other questions and as contributions the time now so by taking one more. Okay. Any questions and as contributions there and then had show you the program ABC High C and Dr. BOADU DOES NOT and addition or the fellow. I hope say I balance soon so the addition being a debate chuma away a brabo. The day I send a by a program meeting. Essential Yonkodoradio for us say on record program every Sunday. Na omoye record area send it to Queen's Women Ministry WhatsApp page so na moment me program living in an TV free home. Once me na silent and so YouTube at Yonkodoradio for YouTube channel, all the live recording of the programs in on YouTube channel and so on. And also, me, I refer and I'm for near Busan for months near the TV, you know, everything I refer more to say YouTube channel, no one so, and then they say, and also what's me a TV. I'm ensuring patrol on Sunday free I say no. If I show him my grace at the patrol baby I want to with me I won't pay am left. Yeah, my grace in Niswa Lieutenant Colonel Chuman Popo patrol baby I want to with me I boy and pay mama.
Yo, agidifo ne adofo mama yensi ye trust ni embre ye kumasi na ye mompa ye. Okronkron Nyankopɔn. Wa hodi utumi boss bo asase bo nipa yi. Ye bo ma ye no kasa samre ya ba wani manmre. Ye da wase ye kanfu din ye yiwa ye esanse wo yo Nyankopɔn. Onkuto ni ani da waso. Esanse wa boy ya ba asase so ye be didi ye be home ye be num na inu na ya de maye yare ye srewa koso chiraye boy ho ban fi yare mu enso mu yade adidi mu yade mframa mu yade adwen mu yade na de enu Dr. Michael BOADU abekire yanwumre ye fanya djuma na maye ho ban ye transase so ensomo because what the abasasi so ye mesumo kusi emra o maye no doba Yesu Kristo awde no maye no beba abe fire ko ana sa obe frɛ amaya ba o eda wasio edwumadi aba ye ebi bɛkɔ adwuma so ka omho di omanim fo mo kodu asumdiem doctor obeye so shira no oni na busua maye no nya nimdie no mfa nche